Hi, I am Dr. Phelouzat from Montauban Clinic Cave in France. And I would like to tell thank you to Topcon for this presentation and we practice a study. It's very important for us for our clinical practice, the patient workflow in consultation. And we do a study evaluating the validity of a Chronos side pilot. It's a guided binocular subjective refraction system compared to a standard orthoptist refraction technique. The Chronos is a novel device that combines binocular autorefraction, binocular subjective refraction, and keratometry measurement in a single instrument. Binocular refraction maintains fusion and reduces measurement variability due to accommodation for improved accuracy. The Chronos side pilot guided refraction algorithm enable automated subjective testing that optimize clinic workflow. It can be operated by an assistant with limited refractive knowledge. The Chronos device is ideal for vision screening with a duration of subjective refraction reduced by 10% on average compared to standard technique. To compare the agreement of automated objective and subjective refraction using the Chronos device with standard refraction by conventional autorefractor and manual subjective refraction. In our study, it's a retrospective single-center case series. Patients with amblyopia or binocular vision disorder were excluded. Our standard method, it was objective refraction by the NIDEC ARK1 autorefractor and subjective refraction by an orthoptist using a phoropter. The Chronos method was objective refraction by Chronos autorefractor and subjective refraction by Chronos side pilot software. The refraction obtained by assistant with no refractive knowledge. The refraction protocol was the patient underwent testing with the standard method followed by the Chronos method. All tests were performed by the same operator. Autorefraction measurement were the starting point for subjective refraction. The outcomes we measure the sphere, cylinder, and axis value, spherical equivalence, Jackson cross cylinder value, and correlation, agreement, and rates of concordance between the methods. In our study, there is 182 patients. There is 361A. There is two versions of Chronos. Before the update in 2023, there is 193A, and after the update in 2023, there is 164A. You can see on the slide there is 47A were excluded from the analysis. No reading returned by a Chronos device for 28 patients. Patient incompatible with the test for 15 patients. Unreliable standard refraction for 4 patients. And you can see a difference between before the update and after the update. Before the update, there is 43 patients we excluded, and after the update, there is only 4 patients we excluded. Following the 2023 software update, A detection by the Chronos device was improved. Measurements with Chronos were slightly more myopic than the standard method. Objective and subjective measurement of G0 and G45 obtained by a standard and Chronos method showed no statistically significant difference. You can see on this slide the height concordance level in green, and you can see the very low no concordance level in red. In this slide, you can see the result of intra-method outcomes with the standard method objective measurement slightly more myopic than the subjective measurement. With the Chronos method, subjective sphere and spherical measurement were slightly more myopic than the objective measurement. On this slide, the results, intra-method concordance, we compare the objective and the subjective refraction. You can see on the up part of the slide the standard measurement, and you can see on the low part the Chronos measurement. And you can see in green the height level of concordance, the difference between the objective and the subjective measurement were lower than 0.25 dioptry. And you can see the low level for the no concordance with a difference more than 0.75 dioptry. There is a very good agreement between standard and Chronos method, was observed on Bland-Altman plots for objective and subjective measurement of a sphere and cylinder. Near zero systematic bias for objective measurement and low positive systematic bias for subjective measurement. There is no proportional bias. The result, the inter-method agreement, you can see that the subjective sphere equivalent within 0.35 dioptry. The standard method show 103A and the Chronos method show 110A. Both methods agreed in 66A and disagreed in 81A. The measurements with standard and Chronos method were strongly correlated. In conclusion, the novel Chronos binocular refraction system showed good agreement with standard refraction techniques, suggesting that the Chronos device is a promising alternative for refraction testing in clinical practice, and that it can be operated by an assistant with no knowledge. Thank you very much.